Welcome to Health Authority TV. I am Janan Sarwar. I'm the deputy editor for Health Authority Books. It's an imprint and partnership between Indie Books International and Global Bookshelves International. I am super excited to introduce you to a pediatrician that I have been a fan of, Dr. Peter Rezkalla. He's also known as TikTok's Dr. Disney. I have so much to say about him, but I'll let him introduce himself. Welcome to our little show.
Thank you so much for having me. And yes, it's been a long time coming. I'm so excited to chat with you because we had chatted a while ago. So yes, I am Dr. Peter. And like you said, I'm a pediatrician who also sort of like stumbled into the world of public health education through the phones that we carry in our hands. And it's been kind of a whirlwind since I started, but a very positive whirlwind. I'm happy for the tornado.
Absolutely. So, being a pediatrician and also having this opportunity to do public health and spread public health information in this digital world that we live in, who is your primary target and who are you talking to and serving in what you do?
Well, when I first started, so I think I'm one of the only doctor creators who started as a medical student, actually. So I was starting in 2017, and it was because I was really stressed out with the step one exam. And I was like, I'm a creative person, all the theater kids who go into healthcare, your identity just morphs. And I said, I need to get back to this creative route. So when I was a medical student, I was more so talking to the public and creating videos about, at the time, the World Health Organization came out with video game disorder because Fortnite was really big. And I
Yeah.
was like, well, I play video games and I like video games, but it's not a disorder. And I looked at the language and it was very big picture, and it sort of vilified all gamers in a way that felt like the body of people who came up with it had good intentions, but perhaps were overreaching in who they were diagnosing with this disorder. Because like going to the gym can be a disorder if you're doing it too much. Dieting can be a disorder if you're doing that too much. So I was more so initially just talking to the public and saying, this is what I've learned from my training. Here are some things you should know. And then it sort of morphed into talking to parents because I'm a pediatrician. So when I work in residency and have conversations with families about what a true fever is, and a lot of people come in and bring their baby, they're like, oh, my baby's having a fever. And I say, okay, what's the temperature? They're like, oh, it's 98. And I would say, okay, well, do they have like, because it is possible that a fever is at 98, but if you have like some neurologic history. But for most of us, it's not. So I had to do a lot of education. So I realized I could, instead of waiting for each patient to come in and them feeling like they wasted their time, the doctors sometimes getting frustrated at patients for not already knowing, I felt like I could just reach out. So the audience has morphed over time, and with the theater stuff I do, sometimes it's directed to the theater kids to give them hope. So it's really just the general public, but if I had to summarize it, it's I'm serving families and children, especially the inner child in all of us.
Oh, that's amazing. I love
Yeah.
that. And one of the first videos that I saw of you was a
Oh no.
video. No, it was a great one. And you were comparing and talking about Mr. Rogers
Oh
and,
yeah.
the principles of that Mr. Rogers applied and how and what you bring as a pediatrician. So tell us more about, the services that you do provide, whether it's to the patients or some of the things that you've discovered, even talking more about this Mr. Rogers bit that you've done.
Yeah, let's start with Mr. Rogers because I've been so gracious to have sort of like a role model to follow and say like he was someone who's genuinely interested in children, and I'm someone who's genuinely interested in children and families. And so I did a lot of research on him, and he really advocated for PBS, public broadcasting station, for
Yeah.
children to be able to have access to free good television. And he was so sweet that he was able to convince there's like a video of him in Congress just standing alone and being very gentle and sort of saying, hey everyone, this is important and let me show you how. And so he really was a bridge for all of these worlds to come together and realize we actually do care about children. So that video also blew up because I went and looked up, and when he would write for the show Mr. Rogers' Neighborhood, he had 9 steps. They called it Fredism.
Yeah.
um, and he sort of like, you can't just direct a kid and say, go to bed. You have to say like, okay, well, I mean, the video is very long, but essentially you have to put it from their perspective and make sure it's developmentally appropriate for them, which takes so much time because you have to like think about how to package what you want to say. And that has really helped me with what I do with social media. So yes, I'm a pediatrician. I go to the hospital. Sometimes I work outpatient emergency room. As a pediatrician, you can kind of do all of it. And on the side, I also sort of help families understand how to take care of themselves and people understand how to take care of themselves, and also advocating for change in the healthcare system. And I think one of your questions is, what would I do if I wanted to fix healthcare, with a
Yeah.
magic wand? And I've been
Yes.
thinking a lot about that because that's a crazy concept. But I think if I had to summarize it, it's that I wish that we were all patient first,
Yes.
because unfortunately, even in pediatrics, as much as pediatricians are the saints of healthcare, I've heard some things in my training like, oh, we can't take care of this kid because we don't accept their health insurance. And I would sit there and I would be truly like having cognitive dissonance, like
Yeah.
watching myself being like, did you hear what you just said? Like so often I felt like I was on candid camera. Like I would turn around and someone would be like, we gotcha.
Yeah.
we're just joking. Of course we're joking. It's a kid. But
Yeah.
no, it's kind of alarming. And I think the system overburdens everyone, that people just keep their heads down. And if you do speak up, especially as a trainee, and that's why I talked about the match day and all that stuff, because you do feel like professionalism is weaponized against you if you say anything. There are studies about this, about like how if you talk about Black Lives Matter, if you wear your hair a certain way, if you have a tattoo, a piercing that's just someone doesn't like or just doesn't like on that day because they're having a personal issue, you could get a professionalism issue. And so I wish healthcare were patient first so that we could all remember, hey, we're servants here. And that's where it should all come from.
That is so fascinating. And your journey through from medical school being and creating all the things, and clearly you've been passionate about what through your theater days to educating others. It's amazing. What has been the most interesting experience you've had throughout this process and journey?
Ooh, from the Dr. Disney side or from the
Yeah.
Dr. Peter side?
What about one of each to close us out? Yeah.
Well, I think I'll bridge them.
Yeah.
I made a video one time talking about how, there was a patient who came in, and they were the last patient of the day, and people were sort of grumbling because everyone wants to go home, and then the
Yeah.
parent had an extra child that they wanted seen, and I was like, I don't know if we can get them on the panel. Everyone wants to go home now. And then that little thing inside me was like, and I'm a very spiritual person, so I do think that like God puts us in places, because there's like a wonderful story in the Bible of a woman named Esther, and she was like so scared, and God was like, sometimes you're put in a place for such a time as this.
This.
And I
Yes.
was like, I don't really want to do anything, but okay. And I listened to this little girl, and I was like, oh, she has pneumonia. And if I had let that slide, that would have been not good. And the family was so grateful. And so I made a video online talking about what to do or how to recognize signs of pneumonia in your kid. And I got a DM from a mom months later, like maybe 8 months later, and I had forgotten about the video. And she said, hi, Dr. Peter. I never told you this, but you saved my child's life. And I was like, what happened?
Yeah.
Did I take care of you in the hospital? Like, what is this? She said, I saw your video on pneumonia, and I had said a specific term called post-tussive emesis, where like coughing can be normal, but if a kid or a person's coughing so much that they can't catch their breath, that they make themselves vomit,
Yeah.
that's alarming. Um, so she said, I realized that my daughter was having post-tussive emesis. And I took her to the pediatrician, who tried to gaslight me and tell me it's viral. And before they walked out of the door, I said, she has post-tussive emesis. And the doctors, like, alarm went up. Their spidey senses were tingling, and they turned around and they said, well, let's get an x-ray. And so they got an x-ray, and she apparently, quote from the mom and the DM, said she had raging pneumonia, and she was hospitalized in the pediatric ICU for 6 days.
Wow.
And she said, I didn't even think to come back to you because it was just a whirlwind, but thank you for what you do. I didn't think I was going to be tearing up. And it's really a beautiful thing that we can really strip all of the nonsense of healthcare away and realize that we're here as servants. And so I talk about those things online because there are so many people in medicine who try to squash pioneers and big ideas or to take over them and monetize it for themselves. So I think that it's important for every trainee who feels the dissonance of healthcare. You're like, none of this is making sense. Don't ever let that brainwash you or excuse it or normalize it, because that is part of the way that you are here to fix it, find a solution for it rather than excusing it. So that was like the bridge of the two worlds.
Absolutely. That is so incredible. You're making such an impact, reaching people, whether it's other healthcare providers. You're an inspiration just
Thank
because you're
you.
putting yourself out there in a fun and unique way. I think that's what's really amazing. And if people wanted to follow you, tell us more about how they should follow you, or if they wanted to reach out, what is your best next step and what you're working on
Right,
next?
right, right.
Yeah.
So I am on TikTok and on Instagram and on Facebook and all the things. I am at Dr. Disney. And sorry, what was the second part of your question?
Where if someone wanted to reach out so we could connect
Oh,
through those platforms, and then anything you want to share about what you're working on, what we can look forward to coming from.
yeah, yeah, more opportunities to combine medicine and art
Wow.
in very tangible ways that I'm not legally allowed to say yet, but
Sure, sure.
they're coming soon and they're very exciting. And that's the I guess the one last thing I want to say is to all the people who feel like they're an outsider or an outlier, maybe in life, but also specifically in medicine, you are the solution. That's why you feel so different, because healthcare is a bunch of people excusing a broken system. Even when I go to these health tech conferences, I've been, pivoting to the world of health tech
Yeah.
again, because it seems like Dr. Disney has been health tech this whole time. And when I'm at these panels and hearing from these people, they're just like, oh, well, we built an AI that can fix prior auths. And so everyone's really solution minded, but on fixing a small little sliver of healthcare. And I'm like, well, why don't we just get rid of prior authorizations, right? Like, that's the problem. We should do a root cause analysis and again, patient first, get back to the very beginning of what actually is the problem here.
Right.
So I think that anyone who feels like they are or have been told that they're the problem, I mean, maybe you actually are the problem, but if you're not actually doing anything that's problematic, then it's because that you're the solution and you're threatening this broken system, which is a good thing. So don't ever fear that.
I love it. Thank you. Thank you so much for your time.
Thank
It's
you for
been an
having
honor.
me.
No, it's an honor to talk to you. Really appreciate it. And for everyone listening, until next time, may you be healthy, wealthy, and wise. Thank you
Ooh,
again.
I love that. Bye, everyone.
Bye.